Hi everybody, this is Dr. Hassan Al-Lawati. Today I'll be talking about guidelines for polycystic ovarian syndrome diagnosis. Now, in order to diagnose polycystic ovarian syndrome, there are so many criteria, and today I'll be talking about Rotterdam criteria. Now, Rotterdam criteria involve three criteria, and if patient has 2 out of 3 of them, then you can diagnose him with polycystic ovarian syndrome. The first criteria is androgen excess. So if the patient is having a clinical sign and symptoms of androgen excess, for example, acne, hirsutism, then you need to keep that as one criteria point. Now, if the patient is having a biochemical evidence of androgen excess, for example, if total testosterone level is normal, high, or patient is having high androstenedione or DHEAS, then you will keep that as a criteria. Now, the second criteria is ovulatory dysfunction. Now, if the patient is giving a history of oligomenorrhea or amenorrhea, then you will add 2 points. The third criteria is polycystic ovaries, and that can be seen by the ultrasound. So the criteria or ultrasoundic criteria to diagnose polycystic ovaries is that you should have at least 12 follicles measuring from 2 to 9 millimeter in diameter, or the ovary volume is more than 10 ml, then you can diagnose polycystic ovarian syndrome by ultrasound. Remember, if you have 2 out of those 3, then you can label the patient with polycystic ovarian syndrome, keeping in mind to exclude other etiologies like non-classical congenital adrenal hyperplasia, which can mimic the symptoms of polycystic ovarian syndrome. Remember that you don't need to get an ultrasound to diagnose polycystic ovarian syndrome. You can diagnose polycystic ovarian syndrome with a normal ultrasound. Thank you. If you have any comments, please write them below.